Good morning, all. Today's topic is hydrocephalus. First, I am going to explain about what is hydrocephalus, and we will discuss what are the etiology, types of hydrocephalus, pathophysiology, clinical manifestations of hydrocephalus, and finally, we discuss about the investigations and management of hydrocephalus. First, the what is hydrocephalus? First, the introduction. The word hydrocephalus is derived from Greek word which literally means water on the brain. Hydrocephalus comes from the Greek words hydro, which means water, and cephalus, which means head. The water is actually cerebrospinal fluid, which is a clear, colorless fluid surrounding your brain and spinal cord. Hydrocephalus is the excessive accumulation of cerebrospinal fluid within cavities of your brain called ventricles. This excess fluid causes your ventricles to widen, which puts harmful press on the tissues of your brain. Currently, there is not a cure for hydrocephalus, but it can be treated. Next, the definition of hydrocephalus. It is a condition in which there is increased cerebrospinal fluid or excessive accumulation of fluid in the brain, leading to increase in the head circumference. Definition of, once again, the definition of hydrocephalus. It is a condition in which there is increased cerebrospinal fluid or excessive accumulation of fluid in the brain, leading to increase in the head circumference. This is the normal brain, normal ventricle and normal brain. Here the brain with hydrocephalus. Look this picture, enlarged head and ventricles filled with extra fluid. This is the comparison between normal brain and brain with hydrocephalus. Next, the etiology of hydrocephalus. Congenital or acquired. Hydrocephalus can be congenital or acquired. The causes are usually genetic but can also be acquired and usually occur within first few months of life. The main causes may be intraventricular matrix hemorrhages, which are common in preterm babies. Next, the infections. Next, etiology is type 2 Arnold-Chiari malformations. Next, aqueduct atresia and stenosis. Next, Dandy-Walker malformations. Next cause is brain tumors, head injuries or intracranial hemorrhages. Next, about the types of hydrocephalus. First, what are the types of hydrocephalus? Non-communicating hydrocephalus, communicating hydrocephalus, internal hydrocephalus, external hydrocephalus, normal pressure hydrocephalus. First, we go through non-communicating hydrocephalus. In non-communicating hydrocephalus, the CSF in the ventricles cannot reach the subarachnoid space. This results from obstruction of intraventricular foramina, cerebral aqueduct or the outflow foramina of the fourth ventricle. The most common obstruction is in the cerebral aqueduct. A block at these sites leads to rapid dilatation of one or more ventricles. In young children, the skull is pliable, resulting in increased head circumference. Next, communicating hydrocephalus. What is the communicating hydrocephalus? In communicating hydrocephalus, the obstruction of CSF flow is in the subarachnoid space, leading to thickening of the arachnoid matter. This thickening causes blockage of the return flow channels. Next, the internal hydrocephalus. In internal hydrocephalus, if the foramina of the fourth ventricle or cerebral aqueduct are blocked, CSF accumulates within the ventricles. This is called internal hydrocephalus and it results in increased CSF pressure. Next, about the external hydrocephalus. It is usually benign and is a condition generally seen in infants and involving enlarged fluid spaces or subarachnoid spaces around the outside of the brain. Next, the normal pressure hydrocephalus. This form of hydrocephalus usually begins slowly and is more common in adults over the age of 60. One of the easiest signs is falling suddenly without losing consciousness. Common symptoms include changes in the gait, incontinence of bowel and bladder, and headaches. Next, about the pathophysiology. Pathophysiology of hydrocephalus. Hydrocephalus is usually due to blockage of cerebrospinal fluid outflow in the ventricles or in the subarachnoid space over the brain. Normally, CSF continuously circulates through the brain, its ventricles and spinal cord, and is continuously drained thereafter. There may be increase in the production of the CSF resulting in hydrocephalus. The accumulating fluid can compress the brain tissue, resulting in neurological dysfunction. The signs of neurological dysfunction will occur soon in adults whose skulls are no longer able to expand. In infants and young children, there will be enlarged head, excluding the face, because the pressure of fluid causes the individual bones which are not fused to bulge outward at their juncture points. Next, about the clinical manifestations of hydrocephalus. In infants with hydrocephalus, CSF builds pressure in the central nervous system, causing the fontanel to bulge and head circumferences increases. The symptoms shall be: in infants, there will be fixed downward gaze with the sclera showing the above iris as though the infant is trying to look its own lower eyelids. Next, clinical manifestation is irritability and seizures. Next, separated suture joints of the scalp bones. Next clinical manifestation is drowsy and sleepiness. Next clinical manifestation is nausea and vomiting. Then brief, shrill, high-pitched cry. Then uncontrolled eye movements and squintish. Next one, altered feeding behavior. Next, the headaches and muscle spasm. Next one is the delayed milestones, and next the bowel and bladder incontinence. These are the clinical manifestations of hydrocephalus. Next, about the investigations. Investigations of hydrocephalus. Magnetic resonance imaging, that is MRI scans, can be used to look for the signs of excess CSF. Next one is CT scan, which can be used to look for the signs of excess CSF and enlarged ventricles. Next test is CSF test to predict shunt responsiveness and or determine shunt pressure. Here is the radiological manifestations of hydrocephalus. This image shows the radiological manifestations of hydrocephalus. Next, the management of hydrocephalus. There is no known way to prevent or cure hydrocephalus, and the only treatment option today requires brain surgery. With early diagnosis and interventions, there will be good prognosis. The most common surgical management of hydrocephalus is shunt system. In shunt operations, the flow of CSF is diverted from a site of blockage within the CNS to another area of the body where it can be absorbed as part of circulatory process. A shunt is a flexible but sturdy cylindrical tube. A shunt system consists of a shunt, a catheter, and a valve. One end of the catheter is placed in the CNS or a cyst or in a site close to the spinal cord. The other end of the catheter is commonly placed within the abdominal cavity or a chamber of the heart or a cavity in the lung where the CSF can drain and be absorbed. A valve located along the catheter maintains one-way flow and regulates the rate of CSF. Then, third, ventriculostomy. It is rarely done, where a small hole is made in the floor of the third ventricle by using fibrotic technology, neuroendoscope, allowing the CSF to bypass the obstruction and flow toward the site of reabsorption around the surface of the brain. Next, the choroid plexus cauterization. Along with third ventriculostomy, the surgeon uses a device to burn or cauterize tissue from the choroid plexus, thus reducing the rate of production of CSF. Here is an image which shows the shunt to heart. This is image for endoscopic third ventriculostomy and choroid plexus cauterization. Next, about the complications of shunt operations. Shunt malfunction, which is a partial or complete blockage of the shunt. Shunt infections. The infections are caused by child's own bacterial organism and is not acquired. Next, the complication is the over drainage leading to increase in the size of the ventricles. Next complication is subdural hematoma. Then multi-oculated hydrocephalus, and next complication abdominal complications in VP shunts. Next is the complications of other surgical procedures. Life-threatening situations due to sudden closure of the pathways created by third ventriculostomy, infections, fever and bleeding, short-term memory loss. Next, about the physiotherapy management of hydrocephalus. Excessive pressure on the brain can result in physical problems in children and may affect their physical development, achievement of milestones, balance, coordination, or mobility. Aims of physiotherapy: to develop good rapport with the child and parents, to promote achievement of milestones, to improve circulation, to prevent contractures and deformities, to improve balance and coordination, to improve functional capabilities of the child, to improve confidence and quality of life. These are about the hydrocephalus. Thank you.